Fantastic Friday to everyone. My name is Malave Contreras de la Fuentes. I am the school nurse at the Winton Preparatory Academy, and I am a licensed practical nurse as well as a registered medical assistant. And I've been practicing nursing since 1996. I've worked with the elderly population, people with special needs, male and female inmates, and now I'm working with the kindergarten through the 8th grade population. I absolutely love what I do. It's very rewarding, and this is the field that I definitely am glad to be a part of. I know I'm making a difference. At this particular environment, as mentioned, I'm working with the kindergarten through the 8th grade, and most of the people that I see here are either diabetics, and those people take the insulin pen or the injection by syringe. Also, I have the people who take albuterol, which is the inhaler. Also, I have people who take oral medications as well. At this particular office, there's a lot of documentation of the medications one takes. If there's an injury, you document that. We're also responsible for obtaining and maintaining current immunization, hearing, vision screenings, dental screening records. So therefore, there's a lot of paperwork that has to be maintained for each student. So anyway, this is the office environment in which I let people rest if they're not feeling well. Ordinarily, I'll make sure that I take their temperature, do an assessment to make sure if there's anything serious or not, so I can know if they can stay in this particular environment or if they need to be taken home or to a hospital, just depending on their assessment. But ordinarily, most of the people that come and see me is for minor bruises, scratches, swollen arm, swollen leg, or a minor head injury. And ordinarily, that can be resolved with an ice pack, some rest. But I ordinarily don't give any medications unless it is over the counter that is from home in the original container, in which I would have to have a consent to be able to administer that medication. In addition to if there is prescribed medication like the albuterol and controlled substances like the Ritalin or insulin, those will be on a medication order with the doctor as well as the parent's signature to allow me to either let them carry it with them or for me to be able to administer it to them as well as storing it. So anyway, if you want to be a part of the school nursing field, one can be a certified medical assistant or a registered medical assistant, depending on your state. Or you can be a licensed practical nurse or a registered nurse. The hours here is from 9 o'clock in the morning until 2:30 p.m. So ordinarily, I've been a part of not having a full 8-hour shift, which is absolutely perfect for me. Some people probably prefer more hours. Some people probably prefer more days in a week. I have been working 5 days a week. However, I have been reduced down to 4 days a week because that was what I originally wanted. But I've been filling in for a person that isn't either is either on leave or we're trying to get somebody hired for that 5th day. So overall I am here 22 to 25 hours each week. Seldomly it does go into more hours, but I love the 22 hours per week because it allows me chances to either go to college and further my education, or I can operate my small business that I have outside of here. So anyway, so it allows flexibility for me. So I'm just basically just trying to give a synopsis of what a person can expect if they're in this field. You may choose different schools and get different types of experiences, but overall is every school has their policies that you need to be made aware of, and also the diversity of the students. So every population is not going to be the same, and every school does not have the same policies and regulations. So make yourself mindful of that. Anyway, again, my name is Malave. Please leave any comments, questions that one would like to have some feedback on. I'd love to reach out to you as well. In the meantime, have a beautiful Friday, and watch out for the next videos. Hasta luego.